of the continuing challenges for cardiologists is keeping the focus on patient care, yet still running a practice efficiently. To talk about what we can learn here at the ACC11 and the I2 Summit, all about practice management, I'm pleased to be joined by three experts. Dr. Mike Valentine is co-chair of the ACC Cardiovascular Leadership Institute, and Mike is also a member of the Board of Trustees. Dr. Jerry Hines is the chair of the Council on Clinical Practice and is also a member of the Board of Governors. And Kathy Biga is a CV practice administrator as well as an excellent nurse, and Kathy is also the co-chair of the Practice Administrators Work Group. So thank you all for joining us. Kathy, let me start with you. What are some of the key trends, the sort of the national trends that are impacting how physicians are going to structure their practice?
Well, I think we're in an exciting time of healthcare right now, specifically as it relates to the practice of cardiology, and not only from regulatory regulations, but from federal regulations and the Healthcare Reform Act. We're now entering into a brand new era of how we're going to deliver healthcare. So we're seeing practices really coming together and evaluating different methodologies of what their practices are going to look like. We're obviously seeing a lot of integration with hospital systems.
Right.
We're starting to see practice-to-practice integrations. And I think it's a challenging time for the college to make sure that we bring the tools, such as what are here at ACC11, to help us go back to our practices and truly be able to govern ourselves in a way that's going to allow us to continue to deliver that care.
You say it's an exciting time. I think a lot of the colleagues would say it's a scary time.
It
And
is.
so, I mean, Jerry, what do you think?
Well, when the college actually put the Council on Clinical Practice together, it was really in response to practices out in the field and that were in the midst of a big change, and the college wanted to make sure that they heard what the practices needed. A year later, and they were worried that private practice was under fire. A year later,
Right.
A lot of those private practices have actually integrated with hospitals. And I think now the college needs to know what's happening to those integrated practices and what the college wants to know going forward what they can bring to their members to help them in those integrated
Very
systems.
important. I'm going to get to you in a second, but let me go back to an issue that sort of when I was listening to Kathy. This focus on quality reporting. Obviously, that's going to impact our practices, isn't it?
Well, and it's something the college has been ahead of for so long, but now it's actually in our practices on a day-to-day basis. So while it's very good that quality is at the center of what we do, the reality is everybody interprets it differently. So the poor physicians that are back in their offices that are getting report cards from multiple sources, the government, the private payers, and all this is becoming very transparent, but is it accurate? So while the college has done excellent with all the NCDR registries and focus and helping us with appropriateness criteria, the reality is we need to make sure that that data that's getting out to the public is accurate and truly reflects how we're practicing cardiology.
So Jerry, is that a reality? Or are we going to be able to do that? Because that's critical, I think.
Well, I think we'll be able to do it, but I think it's as Kathy says, it's critical as the terrain changes under us. We have to keep patients and patient care in focus and make sure these new practice situations don't affect that. And I think that's a challenge.
Mike, I'm not leaving you out in the cold here. You could answer all of these. I know.
I like being the quiet one here.
I'll give you an easy question here. So, you're leading a session on physician leadership in academic medical centers as well as integrated private practice. Tell me a little bit about that.
Well, the session that we're leading right now is a joint session between the ACC, the MGMA, MedAxiom, and others. And really, the transformation of healthcare has not just affected private practices. The transformation of healthcare is not only affecting academic centers, the whole delivery of care, and how we are managing ourselves is affecting everyone. So the fact that over 40% of cardiologists have integrated into hospital systems by the end of 2010 is very impressive. I mean, that's a major transformation in the delivery of how we deliver care. And so that has affected each of us. My group integrated 5 years ago. Kathy's groups have integrated in the last year. But academic centers are also changing. So this transformation affects us all, as you well know.
Yeah, well, that's fabulous. Jerry, let me ask you, and I'm going to come, Mike, you can jump in on this too. How have the practice and compensation trends that we certainly see over the past 2 years, how have they impacted practice? What have you been hearing?
Well, obviously, part of the issue has been the declining reimbursements and revenues have forced certain practices to reinvent themselves. And part of the solutions that some practices have come up with is the integration model. I think if you step back from it, though, this is a business and an industry that's in the midst of a huge change.
Absolutely.
And we're going from mom and pop industries on the corner to a different delivery healthcare system. And I think there's going to be changes in compensation. I think we just have to learn, and I think the college is going to help its constituents learn how to deal with this new business.
No, I mean, I'm really intrigued, and I think everything Kathy was talking about. Mike, let me come back to you, because if integration looks like it's a train going down the tracks, what are the key business processes that practices that don't want to integrate can do? I mean, are there messages for them?
Well, you know, when we were just running this session, 2 physicians came up to me afterwards and says, I'm in a 3 to 5 man
Right.
group. What does my future look like? And obviously, that's not a great. It doesn't look real good for very small mom and pop operations. And we know that as the costs of running your practice increase on a linear slope, and your reimbursement's declining, then trying to run a very small business is going to be more and more difficult. We think that those that are in small groups like that need to look also at what we call horizontal integration. As your group gets larger and larger, or you merge with other groups, or you run IPAs, as we were talking about, which are independent practice administrative groups, then you're able to not only lower costs but increase your bargaining power with hospitals and with payers, hospitals, and all groups. So the mom and pop organization of 15, 20 years ago, where our moms and dads practice medicine, has dramatically changed. In fact, there was an article on the front of the New York Times yesterday about the change of medicine and then the change of physician practice, and it had 3 generations, and the dramatic change that the 35-year-old doctor now doesn't want to work 90 hours a week like her dad did. All those group things are changing our
But Mike, you're saying that, but while you say it looks dim, but there are things that a small group can do. That's what you're saying, Kathy.
Absolutely.
Is that right?
Yeah, and I think the other key is that compensation is so near and dear to physicians' hearts, but there's different ways of distributing compensation, and there's different mechanisms out there for even the small groups to participate. PQRI, e-prescribing, the
Right,
health information monies. We need to make sure that we help our small practices get into that, and the college has got a lot of different courses, and the summit perhaps that we'll be doing in January
Well, I
is
mean,
going to help
this
them.
is really. I mean, I'm thrilled that you guys are all involved and the college is involved, because it's critical to our future. So it's a lot for us to think about. Thank you for joining us.
Thank
you.
you.
Thank you.